Welcome to ECG Made Simple, recognizing drug-related changes in adolescence. This course has been designed to strengthen your skills in identifying ECG changes related to substance use in teenagers and young adults. Over the next 2 CPD hours, we will cover normal versus abnormal adolescent ECG parameters, stimulant-related ECG changes, cannabis and vaping-associated ECG disruptions, clinical red flags and escalation pathways, real-world decision-making using clinical scenarios. Our goal is to ensure you feel more confident and structured in recognizing and managing ECG changes caused by drug use in adolescence. Who should take this course? This course is designed for healthcare professionals working with adolescents across a variety of settings. It is most relevant for registered nurses in pediatric, adolescent, and emergency departments, pediatricians and pediatric registrars, general practitioners managing young people in community settings, rural and remote health workers without immediate cardiology support, clinical educators, medical students, and junior doctors seeking confidence in ECG interpretation. All of these professionals are often the first point of contact when a teenager presents with chest pain, palpitations, or collapse. Recognizing drug-induced ECG changes quickly can save lives, avoid unnecessary referrals, and reduce anxiety for families. Why this course matters. Adolescent drug use is more common than ever, and its cardiovascular effects can be subtle but dangerous. Stimulants, such as ADHD medications and methamphetamines, can produce tachycardia, QTc prolongation, and arrhythmias. Cannabis and vaping can trigger rhythm disturbances that may be misinterpreted as anxiety or normal athletic changes. Unfortunately, many of these ECG signs are missed or dismissed. Nurses and junior doctors may attribute changes to stress, fitness, or normal variance. This course provides you with a structured approach to confidently interpret adolescent ECGs in the context of drug exposure. Early recognition of these patterns prevents escalation to serious, life-threatening arrhythmias. Module 1. Introduction to Adolescent ECG in Substance Use. In our first module, we look at why adolescent ECGs are unique and how drug use complicates interpretation. During puberty, cardiac physiology changes significantly. Differences in sex hormones, athletic screening pressures, and rapid growth can all influence ECG readings. When drug use is added to the picture, interpretation becomes even more complex. Substances can produce overlapping changes that mimic normal variants or conceal underlying pathology. Many nurses and junior doctors lack confidence in identifying these subtle changes, leading to missed opportunities for early escalation. By the end of this module, you'll appreciate the clinical importance of careful ECG analysis in adolescence and why missed drug-induced changes can have serious outcomes. Module 2. Normal versus abnormal ECG in adolescence. In this module, we'll establish a solid foundation by reviewing what's normal for adolescents. Heart rate, PR interval, QRS duration, QT and QTc values vary with age, sex, and pubertal stage. For example, a QTc that is normal in a 12-year-old boy may be borderline in a 16-year-old girl. Distinguishing borderline versus abnormal values is essential. We'll use real case tracings to compare normal adolescent ECGs with stimulant-affected ECGs, highlighting subtle differences. By learning these norms, you will avoid the common mistake of applying adult values to teenagers and will gain confidence in separating benign from pathological patterns. Module 3. Stimulant-induced ECG changes. Here, we focus on stimulant drugs. ADHD medications, including methylphenidate and amphetamines, may cause mild tachycardia and QTC effects. While usually safe, these changes require monitoring. Methamphetamine use presents a much higher risk, with tachycardia, QTC prolongation, and sometimes arrhythmias. Clinical red flags include palpitations, collapse, syncope, and family history of sudden cardiac death. We'll also review current AHA-AAP recommendations for ECG screening before starting stimulant therapy in high-risk adolescents. Finally, we'll apply this knowledge to a case study, a teenager on ADHD medication presenting with tachycardia. Module 4, Cannabis and Vaping-Related ECG Disruptions. Cannabis and vaping are increasingly common among adolescents, and both can cause ECG disruptions. Cannabis has been linked to conduction disturbances and rhythm instability. Vaping is often associated with tachycardia that may be mistaken for anxiety or athletic heart. The challenge lies in differentiating benign sinus tachycardia from drug-related abnormalities. We'll explore a case study of a 16-year-old presenting with cannabis intoxication and an abnormal ECG, highlighting the steps you should take in recognizing and escalating care appropriately. Module 5, Clinical Red Flags and Escalation Pathways, Teaching Script. This module provides practical guidance on escalation. Red flag symptoms include unexplained syncope, chest pain, palpitations, and family history of sudden death. QTC values greater than or equal to 480 milliseconds, unexplained tachycardia, or suspected arrhythmias demand urgent escalation. When in doubt, always communicate uncertainty to the cardiology team. It's safer to escalate than to miss a dangerous finding. We'll walk through a stepwise escalation pathway for emergency, GP, and rural contexts, giving you a reliable structure to follow in real clinical practice. Module 6, Clinical Scenarios and Decision-Making Practice. To consolidate your learning, this module uses practical case-based discussions. Case 1. Teen vaping with tachycardia. How do you decide if it's benign or cardiotoxic? Case 2. A 14-year-old on ADHD medication with borderline QTC. Do you continue treatment or escalate? Case 3. An adolescent with cannabis intoxication showing conduction changes. What's the safest next step? These scenarios help you apply the frameworks from earlier modules to real-world decision-making, building confidence for your own practice. Learning outcomes. By the end of this course, you will be able to explain how adolescent physiology affects ECG interpretation, identify normal versus abnormal ECG values, including borderline cases, recognize stimulant, cannabis, and vaping-induced ECG changes, escalate appropriately when red flags are present, apply structured workflows for substance-related ECG interpretation, communicate ECG findings clearly to senior clinicians and cardiology teams. This structured approach ensures safer, more accurate care for adolescents. CPD Course Assessment. At the end of the course, you'll complete a short knowledge check covering normal versus abnormal adolescent ECG thresholds, stimulant-related ECG changes and red flags, cannabis and vaping-related ECG disruptions, real-world escalation pathways. This assessment reinforces your knowledge and prepares you for applying these skills in practice. certificate, and CPD credit. Upon completion and successful assessment, you'll receive a digital certificate of completion confirming 2 CPD hours in pediatric and adolescent ECG interpretation, focused on substance-induced ECG changes and escalation pathways. This certificate can be added to your professional portfolio, demonstrating your commitment to safe, evidence-based adolescent care.